Welcome back, everybody. I know a lot of people are concerned about ever-changing symptoms of coronavirus. That's why we're going to talk to an expert this morning about that, because you've been asking us a lot about it and also answer some more of your questions. Right now, we join Dr. Hannan with Signature Care Emergency Center to ask those very questions. Good morning, and thanks for joining us. Talk to us about those latest symptoms, which is loss of smell and taste. Why is it so concerning that this has popped up without any other symptoms?
It is very concerning that people are having only loss of taste and smell. The good news is that this is not unknown. A lot of people with viral syndromes will get loss of taste and smell, and most of the time it is a temporary phenomenon. It gets better as the illness gets better. However, the concerning thing is that people may not have anything else. They may not have fever, may not have cough, and they may still be infected with COVID. The recommendation still right now is that if you are not very sick, do not go to the doctor's office or try to get tested. If you are getting loss of smell or taste, it may be a sign of COVID infection. However, still stay home, call your doctor, don't go into the emergency room or try to get tested only because you have that symptoms.
Okay, but definitely stay away from your family and friends as much as you can, I would think, like you said. Okay, here's a viewer question, and I think a lot of people are really enjoying the fact that they can go get takeout food, but they're still concerned that whoever prepared it might have been sick. So one of our viewers wants to know, if they freeze that food once they get it from a restaurant and then warm it up later, would it be safer where they could just be, completely worry-free about it? And I'm sure this is probably someone who might have a compromised immune system who's particularly concerned about it.
So as far as takeout food is concerned, if you can clean the surface of the package or throw away the package, absolutely, that's one way to protect yourself. Wash your hands once you handle that package. And as far as the actual food itself is concerned, if it is a cooked meal, it's less likely to transmit coronavirus because coronavirus is known to not live beyond a certain temperature, and a cooked meal where the water is boiling clearly is something that will destroy the virus. However, if you're still concerned that even after the food is prepared and after that, if the food is contaminated, if you want to reheat the food at a very high temperature, that may also be a good way to protect yourself.
That is very good to know, and it affects just about everybody I know, wondering what to do about it. And then I just remember to, I guess, clean your hands once you touch that packaging as well. It's always good. Dr. Hannan, thank you for your time. You've been so helpful throughout all of this, and we definitely appreciate your expertise. Now, if you have more questions, we're going to do our best to answer them today. So you can text us right now. 281-572-6816 is the number to text, and we'll do our best to answer those. Hello again, everyone. Happy Monday morning to you. Yes, it's Monday. It may not feel like it. Might still feel like the weekend, but here we go. We are here to answer your COVID-19 questions this morning. Joining us once again, and we are thankful for that, is Dr. Hannan with Signature Care Emergency Center. Good morning to you again, Dr. Hannan. I'm going to get right to our first question, and that is there any way to know if I'm a carrier without taking a test?
Even with the test, it's difficult. So unless you're having symptoms, there is no way to tell if you're a carrier. There are a lot of people out there that do not have any symptoms. And by definition, the way this virus works is it takes about 5 to 7 days for someone to develop symptoms. So once you get infected, for 5 to 7 days, you will have no symptoms. You may still be spreading the disease. So it is very important to be careful. And the interesting thing is, even if you test, sometimes the tests are coming back inconclusive or incorrect. So even with the test, it's very difficult to tell if someone is a carrier or not. That's why it's important to assume everyone is a carrier.
The safest way Okay, got it. Another viewer wants to know the safest way to eat fruit. Should they peel it or should they skin it? Do you have a suggestion for that?
So peeling is a good idea. Make sure you wash the fruit very well, and after you wash it, if you peel it, or if you yeah, peeling should help you, but make sure you wash it very well first.
Okay, and another viewer says that they're a caretaker of a 90-year-old, but they're wondering if they're doing that 90-year-old more harm than good by going there to check on them, to take care of them. What do you suggest to people who are really needing to go to check on their elderly loved ones, or perhaps they're a medical care worker and need to check on a patient?
So it is important to check on the elderly and vulnerables, because they may need the extra help in this time where they cannot reach out, they cannot go out. So what I would recommend is exercising extra precautions. If you must go in to check on someone, if you don't need to go inside the house, from the outside the house, if you can communicate with them, if you can visually see if they're doing well and talk to them, and they don't need anything, then there's no need to have contact with them. But if you must go inside to provide some essential support, then make sure you're wearing protective equipment such as masks, gloves. Make sure you clean yourself properly before you go into their place, and make sure they're cleaning their locations after you have departed the place.
All right, we appreciate that medical advice. Dr. Hannan, always an honor to talk to you. Thank you again for your time today.